My case today is about a COVID-19 multisystem dilemma. I first encountered this patient in the laser unit. He's a 12-year-old charming child. He was referred for bilateral fundus Versine angiograms and OCT macula, and he complained of headache and bilateral acute diminution of vision for a few days. He had a significant medical history for COVID-19 infection 4 months before presentation, and after recovery, he had some sequelae in the form of fever, skin rash, arthropathies, abdominal pain, and vague history of pyelonephritis. He had no significant ocular history. He had elevated ESR and CRP at the time of examination. And when I examined him, the best corrected visual acuity in the right eye was 0.2, the left eye was 0.1, and his posterior segment shows this characteristic picture of severely hyperemic elevated disc with extensive exudation reaching the macula in the right eye, and the same picture in the left eye with a characteristic macular star. It reminded me of the Eye of Sauron from Lord of the Rings, if you're familiar with the reference. I did the fluorescein and I saw early leakage from the disc with telangiectatic vessels with late staining. Same picture in the left eye, but in the left eye I saw this peculiar vascular loop. I didn't know what this is. The OCT showed extensive edema and exudation, and I diagnosed this patient clinically with bilateral neuroretinitis. I also consulted senior staff about this vascular loop, and they suggested this could be Irvan syndrome. I will come to that later. So I referred the patient urgently to Abu Rish Ophthalmology and Pediatric departments, who requested a comprehensive systemic workup and injected the patient with posterior subtenon injection of triamcinolone in one eye. But after 2 days of presentation, the patient called me and said that the child had suddenly died. So how did death win in this situation? I had many puzzling questions. What's the cause of death? Is COVID-19 the culprit? Is it a viral or immune etiology? And is it neuroretinitis or Irvan? I also was bugged about the onset. If it's viral encephalitis, why after 4 months of infection? And why did he develop rash and systemic manifestations after COVID-19? I reviewed the literature and found this very well-documented entity called multisystemic inflammatory syndrome in children, and it had many ocular manifestations. So what is this MISI? It's a novel childhood syndrome. It's Kawasaki-like. It's associated with COVID-19. It's a delayed post-COVID immune dysregulation. It has many systemic and ocular short-term and long-term effects and can be potentially lethal. In this study, they mentioned that MISI has a latency phase of 4 to 5 weeks and sometimes more, and can be associated with myocardial dysfunction and shock. And ocular manifestations can be the first signs, so we have to check these patients early to save their lives. Also, there has been reported mortality following MISI, especially in middle and low-income countries like ours. This study said that there were many systemic manifestations. My patient had fever, skin rash, abdominal pain, and joint swelling. So I was starting to collect the dots that my patient may have had this syndrome. There were many ocular manifestations. The most common is non-purulent conjunctivitis, which can be easily missed. He may also develop retinitis, uveitis, subconjunctival hemorrhages, and papilledema. So back to our patient, what's the cause of death? Is it encephalitis, increased intracranial tension, or myocardial dysfunction and shock? I wouldn't really know without an autopsy. Is COVID-19 the culprit? Probably. Is it a viral or immune etiology? Probably immune MISI. Is it neuroretinitis or Irvan? So Irvan is idiopathic retinal vasculitis, aneurysms, and neuroretinitis. It's caused by intraocular inflammation leading to segmental vascular wall weakening and formation of aneurysms that look like this. So is it like my patient? I really leave that to the audience. So my take-home message is that COVID-19 infection in children is not always a breeze. Any child with unexplained ocular manifestations and history of COVID, please refer this patient to a pediatrician and a cardiologist. You may save his life. And this could be the first report of post-COVID Irvan syndrome. And thank you, and I thank these doctors for helping me with this case.